respected viewers and followers of Jungle Community, today Jogo came all the way to the Sada Conference Hall to witness the Gambia International Social Protection Conference on the theme Investing in Resilience Towards Long-Term Financing of Social Protection. Join me, your host Hadi Jallo, as we delve into the program and get an insight on what they are discussing.
Participate in decision making in how and where to invest the cash into in the company. Yes, we know still, at the end of the day, men still have the control, largely have control, but women are empowered to participate, to bargain as to how the cash should be used. That's what we have discovered in the impact evaluation and also the analysis. We have seen that it has helped us to improve food security among the household. Both impact evaluation and panel analysis have shown improvement in food security. For impact evaluation, improvements are there. What they try to do is how significant is the impact, is the improvement. That's what the impact evaluation try to find out. Yes, it is there, but from the evaluation perspective, the improvement is not significant as far as the analysis is concerned. However, it has shown that cash transfer can improve household food security, enabling beneficiaries to eat better food, to eat 3 square meals a day, despite limited funds. That is what the impact evaluation have shown. The panel analysis, on the other hand, looked at diversification of the diet. Food consumption score has improved over the years. Household food consumption score has improved in the baseline and the follow-up by 8 to 11 percentage points over the period. After 1 year of suspension, there are still households that are maintaining good food consumption score. I want to remind this gathering that when the social safety project ended in 2023, the cash transfer ceased for a year. During the course of that year, before the Gambia rights became effective, we are not giving a cash transfer. But despite that break, 70% of households still maintain good food consumption score, meaning they are consuming diversified diet. It means they have adopted the behavior of consuming diversified diet and they have ways and means of maintaining it. Households are helped to smoothen consumption and also diversify their diet, an effect that proved resilient among households, as we can see in the graph. That is also a second area of improvement. The other area of improvement is we have seen that savings and financial behaviors has improved. This is evident from the impact evaluation. It has shown some improvement. Again, not very significant. Particularly if you compare it with the wealth index, the household index, the business ownership is not very significant, even though it has improved. The resilience has improved, not significant because if you look at the issue of the break it has held in the shock response, the COVID strategy index were not significant, particularly because of the fact that there was a 1 year break between the baseline and the follow and the end line. However, the panel analysis, which occur annually, shows some improvement, particularly in terms of households that are able to save. Dealing with extreme poor, meeting their consumption, meeting their basic need, and getting into savings is a big improvement as far as the extreme poor is concerned. We have seen that households have 6 more times likely to save than those that are not receiving cash. The same behavior persists even after that break. Most households still do a bit of saving. We have seen improvement in saving asset and business resilience is also improved. We've seen that households are using the money, the cash to improve on consumption, but not saving enough. Very limited, they are saving very limited saving. The 25 provide temporary relief for the household, especially in terms of food, household need, medical expenses, but they also depend on external support still maintained. Some households, what they do is what we call in Gambia susu. They will put together some funds, give it to one of the households to accumulate so they are able to set money for emergencies, use that to buy small ruminant, sheep, goat, or poultry, or get in backyard garden, or some get into small businesses that they can also rely on. However, what we have seen is access to formal savings. The banks, microfinance institutions are not very much used in the project area that we are implementing. And this is also shown in the panel analysis. Even though business are improving, yes, households are getting into income generating activities. We have seen after 1 year, 4.7% of households run an income generating activity, either small business, rearing sheep or goat, poultry or backyard gardening. We've seen that even those who started after the expansion from the pilot to the main expansion, there are 30% of households that get into new businesses to earn some income for the household. Even after the 12 years suspension, there are still households that are maintaining their business. Some are even diversifying their businesses as far as the impact by the panel analysis is concerned. We have seen improvement in behavior change communication. The impact evaluations have shown that there's improved health care and infant feeding practices. Particularly, women are now feeding their babies or children with better food, very diversified, nutritious diet, which is building national capital. We've seen that they are adopting new ingredients that will enhance the diet of the children. We've seen households understanding dietary need of different people in the household, the children, the adolescents, the pregnant women, the lactating mothers, the elderly. They are now understand and know what type of food those people need. They are also seeking care early. Healthcare seeking is also a behavior that has been ingrained in people so they can get treatment as quickly as possible. You are seeing people are sending their children to school. It is showing that schooling is becoming easier for households, particularly for the fact that they are able now to provide uniforms, school shoes, and other school supplies and lunch to their children. We have seen improvement in knowledge and attitudes regarding antenatal and postnatal care. The studies now learn that it is important for pregnant women to consume diversified foods. The IPC network have a fair knowledge and are able to identify the signs of pregnancy that they can detect early and seek advice to prevent any catastrophe. The transfer has cost help them to take care of the medical bills that they come across. It helped them to make some of the basic needs. And we have seen optimal infant and child feeding, particularly exclusive breastfeeding, being adopted in the households. We've seen that gender-based violence is one of the areas that communities are a bit reluctant to discuss based on the sensitivity of gender-based violence. People are not reluctant to discuss this openly, showing the topic is not very comfortable for open discussion in the community. It remains a challenge and a limitation. And similar findings have been shown in the panel analysis, particularly focusing on the family and social well-being topics, family planning, adolescents, parenting, child protection, are topics that have improved in terms of knowledge and practices. GDP shows an initial improvement, but it declined a little bit because people don't want to discuss about GDP openly. Knowledge gains were modest in productive inclusion and financial domain, but this is a program in progress. The biggest impact that I like is the improvement in health and nutrition outcomes. As a nutritionist, when I see this from the impact evaluation, I feel the NAFA has been very effective. It is very difficult to reduce malnutrition. It it's difficult to fight malnutrition. And we have seen in the impact coalition that moderate acute malnutrition has reduced by 3 to 3.5 percentage points. A big impact. Thanks to all the partners who have contributed to this. We've seen an improvement in infant and mental feeding practices, diet diversity, exclusive breastfeeding, frequent on-demand feeding has all improved, which are contributing to the development of human capital in the Gambia. We look at value for money, how cost effective is this program. The impact evaluation also look at the cost effectiveness of the program. And it has shown that the program is cost effective in addressing poverty. Yes, we are spending money, particularly if you look at the graph, it shows that 55.9% of the fund goes directly into the beneficiaries. There are accompanying measures, including the cost of the card transfer, the payment to the PSPs, 1.7%. It shows that SBCC, as an accompanying part of the program, constitutes about 19%. The social registry that we use contribute about 19.88%. So if you look at the composition of this, the funds use, it shows efficiency in the use of the funds to address poverty, to improve and build on the resilience of extreme poor in the Gambia. Those are the findings. How do we sustain this gain? It's the biggest question. Yes, improvement has been shown, but how do we intend to sustain this over the period? And we look at this at 3 angles. The first angle is building resilience through skills and entrepreneurship and financial literacy. We are encouraging households to venture into income-generating activities, and this will help them to build resilience and continue to sustain what they have gained in the program. Secondly, we believe that adopting behaviors that are important for building human capital will help to sustain the gain. Every household that have a child that is exclusively breastfed, and they have seen the benefit in that, if they have another child, we are sure they will be able to practice exclusive breastfeeding. Any woman who has suffered from a pregnancy-related sign or symptom that they are educated on, understand, they know, and they are helped to take care of. If that occurs again, they'll be able to take care of themselves or advise somebody to. So the behavior that they adopt will help them to maintain and sustain that behavior. But as a government, we are advocating to the government and the Vice President Office for the government to adopt NAFA as a program geared for alleviating poverty. And inshallah, it will become a national program. Hence, we are getting towards national coverage. Along the line, we have learned some key lessons. For those who want to emulate this program as a program, we have learned some lessons. One of the lessons that we have learned is, if you want to go into this kind of program, you have to have the documentations, and strategies right. In this program, we develop manuals and strategies to facilitate smooth implementation. The project operational manual, the SPCC strategy, the community mobilization strategy, the M&E strategy, the fiduciary, looking at financial management, procurement. You have to have a guideline that will help you to better and smoothly implement the program. That's one thing that we have learned. We've learned that for SPCC to have an impact, we have to use multiple approaches to deliver SPCC. This not only creates opportunity to reach wide coverage, but it also enhances understanding among the beneficiaries. We've seen a community validation that we do. When we get a list from the social registry, we validate the list. That process has helped communities to have confidence and trust on the program. You go to any community, ask about NAFA, they have trust and confidence because they are aware of the processes involved in identifying and enrolling the beneficiaries in the program. We use the MIS to capture the data, and the MIS has facilitated real-time reconciliation, but also help us to verify and payments, and after payment, you do help us to reconcile the payments and the cash use. Effective GRM is important in any program, especially dealing with cash. You have to have a strong GRM system. It helps us to manage complaints or queries that we have in the system. And capacity building is important. Those that are involved in the implementation of the stakeholders, central, regional, and the community level, you need to build that capacity for them to efficiently execute their roles and functions in the project. These are lessons that we have learned as perspective of the program. In terms of M&E, we have learned some lessons. One of which is that a modest cash transfer like the NAFA, 1,500 per month, deliver a meaningful short-term gains in the household, as you can see in the slide before. It helps us to have a predictable support that improve and enable household to have 3 square meals that is diversified and nutritious. In the long term, it can be a sort of income generating for poor and extremely poor households. We've seen in the impact evaluation and the panel analysis that SPCC effectively improve knowledge on health, education, and family planning. We've seen that knowledge gain do not always automatically translate into behavioral change. One typical example is the DVP module. It's a module that we have been promoting, but the behavior is still not to the level that we desire it to be. Program messages on utilization funds for other household use was effective. We ensure that we empower women, we empower households to effectively discuss the use of the fund for every member of the household. Engaging community structures effectively in program delivery, including cash delivery, is important. If you are dealing in the community, you have to involve them in the implementation of the program. So community engagement is important. And successful delivery enable multi-sectoral, multi-stakeholder approach with clear-cut goals and responsibility and generally structured coordination mechanism. We have to ensure that we coordinate, we synergize, and we complement one another in a multi-sectoral approach to fight poverty and improve resilience. These are lessons that we have learned from the perspective of the impact evaluation. What are the recommendations? We are recommending that in the future, we look at the complexity of the household dynamics. The NAFA gave one cup fit all based on average household of 8 meeting their food basket need. We know households differ in numbers and taxes and capacities. So if we are getting into the future, when we are designing this kind of program, we have to look at the household dynamics, to look at what is feasible for a household of 8 members, a household of 12 members, a household of 20 members, and a household of 4 members. If you give a household of 12 members 1,500, a household of 3 members 1,500, the impact will be different. So we have to look at that dynamic in the future. We also have a complaint SPCC. In terms of knowledge and practices, we have to also complement this with life skill training, particularly focusing on entrepreneurship, financial literacy, investment decisions. This will be very helpful in building resilience for the future. We need to strengthen our targeting and the grievance mechanisms so that no complaint is left unanswered. By further engaging communities in the criteria for identification, by ensuring that the GRM system is accessible to everybody without any condition or problem. We will need to continuously improve on the payment mechanism to reduce the burden on logistic to the beneficiary. The world is going digital. We have to see how do we align digital technology to deliver the cash, but also enable us to carry out behavior change communication sessions at the same time. We need to explore the complementary interventions such as school feeding program to leverage on the positive playful parenting that is trying to improve child welfare, stimulate child welfare, prepare them for enrollment into the school. So this also can also leverage on the school feeding and others. We have to ensure that we enhance gender transformative programming that directly address barriers women are facing. Like I said, if you empower women, you empower the entire household. If you empower women, you empower the entire nation. And this is what the party is doing. This is what we expect every program in this country to do, enhance resilience. Thank you very much.
Thank you very much for that presentation, sir. So do we have any questions, any observations from the NAFA presentation?
Thank you very much. The name is Mohammed Dikobala from Nigeria. Well, not really a question, but a commendation in terms of even the naming of the program NAFA coming from the cultural perspective. Unlike sometimes you have it around the world, cash transfer directly, as a project, national cash transfer program. But now you have NAFA coming from, the way you said, the pause for women. And most often, sometimes even the name cash transfer pose a threat to the implementers. Some of these people think the money you are giving to the communities belong to you. So most often we have our facilitators, as low as the community facilitators, being attacked in their houses, thinking that all the monies are in their house, talk less of the national coordinator. So sometimes it's good to go by, and it will be better, it will have a better understanding. Well, my question again is, when COVID hit, most of our registries are coming from the rural perspective, and the data are from the rural, and then COVID, most people are affected, that are affected are in the urban areas. So what were the systems in place, to extend, assistance? Though I know, but strategically, the government will rely on your office and that of the national, where the registry is, for them to now say, okay, when COVID hit, there was this restriction of movement and what have you. We are not there yet, quite all right, but what are the initiatives by the government of Gambia to deliver assistance during COVID and anticipated shocks, economic and what have you, that including disasters that are coming? There should be a strategy, a roadmap for that. And then lastly, it's about the allocation of these cash transfers based on households, communities, and I know the communities allocations are sorted because you use poverty maps, but the number of households within the communities, there's a lot of political economic questions that may arise in terms of, okay, how do you now apportion a number to the communities? Yeah, quite all right, the communities are selected based on poverty maps and what have you. We agree based on this, but what of the households? What are the strategies used in selecting the number? Okay, now we are giving 10 to South region, 5 to Eastern region, 6 to Eastern region. What were that inform the decisions? Is it okay? This is the hometown of the vice president, give him 10. The hometown of the president, oh, I'm the coordinator. Look at the registry. I need, there is these political questions. So how do you contend that and resolve that? Thank you very much.
Thank you, Mohammed.
Thank you very much, Mr. Fofana. I would want to start by putting on record or placing on record my sincere thanks and gratitude for the very good job you have been doing over the period. I am Ibrahim K. Damfa, former governor, now deputy ombudsman. I want to thank the agency and Nana, as it were, for all the good job you have been doing. We've heard from Mr. Deva earlier in the day. During his presentation, the 15 minutes he was able to impress us with all what you have been doing for the Gambian people. It's a very good job you have been doing. At the initial stage, I'm sure Mr. Barra would confirm, I was among the first set of governors who were called upon to be part of this crusade from the start. And I've seen it grow from strength to strength. And what the people have been doing at Nana level with the NAFA project is very much impressive. And I want to thank you for the very good job you have been doing. I am also happy to know that you would want to expand because of the success story that it has been so far. The Gambian people want it to be expanded. I know there is a lot of poverty in this country. When you talk about rural poverty, just come down to urban poverty. Poverty is a cross-cutting issue. Sometimes you think that once you are in the commons, where perhaps there is a lot of money flowing around, you think there is no poverty there. But I can tell you from experience that there is a lot of urban poverty in this country. And you need to expand as quickly as possible. That takes me on to what the previous presenter, Madam Ecowas, sorry if I say Madam Ecowas, you talked about the horizontal expansion. And in your mission statement, not the vision, but the mission statement for the ECOWAS framework, you mentioned care to be given to the horizontal expansion, that we have to be very careful. Rather than helping people, government may not want to expand, come up with policies, to make people suffer, to give them more burden onto to increase their crisis. I want to know from the ECOWAS angle, what would be your advice to now that you know where we are at the moment, you have been there with us along the way, what is your advice to government? Yes, the political commitment is there, but it's important that you give us your advice from that level, ECOWAS level, so that we can avoid, rather than taxing, more taxation on the people, rather than helping them, you start to give them more burden onto their crisis already. So what would be your advice for the government and for the agency to be mindful of? I remember at some point in my earlier years as a teacher, there was this issue of $1 as a policy, taxation on dollars each across the board, so that as an education fund. So if the government is to avoid that, what would be your advice to safeguard against such things? And Malam, finally, quite apart from thanking you for all you have been doing, I just want you to throw more light onto, I know that you are using what you call integrated household data that you have been using. I want to know how frequent is the update of your data. Poverty is a cross-cutting issue, and it's never dynamic. It's dynamic. It's not static. You will know that because in the same hall here now, at some point, there is a lot of money coming from outside to this country, and one household's poverty in September may change in October. So I want to know how dynamic, how frequent is your data upgrading, because it's important to know for you to determine whether your integrated household data is static or it is dynamic in terms of operation? Thank you very much.
Thank you so much, and thank you so much. And my name is Obasa Peter from the small Republic of Kenya. I just want to echo what my colleagues has just said about community targeting. And as you know, the demand for money is more than the supply for money. How do you manage the politics around the community? How do you manage the gatekeepers? How do you manage the political class? And how do you manage yourself? Because that is more important. You are a family and you must be able to defend your family. How do you manage yourself vis-a-vis the program? I want to look at a slide that you presented about the expenditure that goes to the community, to the cash transfer, vis-a-vis the expenditure on program functions. If I remember very well, it was 5.6%, 4.9, almost 56%. That is the funding that goes direct to the beneficiaries. That leaves you with around 40%. Don't you think it's a little bit higher in terms of administrative costs, because the entire bulk that is left is purely administrative? And if that is the situation, how do you reduce it so that more money goes to the community to change the lives of the community vis-a-vis more money being on administrative? Because even SBCC is purely administrative. Every other thing is purely administrative. And finally, in your research work, there's a segment that has just been avoided, whether intentionally or otherwise. Persons with disability. Where are they? Or Gambia is different, you don't have people with disability. The nutrition angle affects especially children below 3 years who have CP, Down syndrome, and the rest. What are the results of the impact telling us? Maybe you might have forgotten it in your presentation, but how are milestones achieved with the program intervention that you have put in place so that we can see, yes, the program came to address the challenges of disability, especially the first 36 months of growth. That's critically important, especially for nutrition persons like you. You might want to understand whether the program really targets and really changes the lives of those who are living with disability, not living those with disability, so that at least it can be addressed. Thank you so much.
Thank you all for the compliments and the comments, as well as the questions. Let me start with my brother from Mr. Nabilia Mohammed. Mohammed, thank you for the comments. The question of the COVID-19, how do we deal with COVID-19? We know COVID was a menace across the continent, even our own Gambia. And as a government, we also have policy that restricts people from moving. So during time of COVID, we took some part of the project fund to do a near universal cash transfer. But this came at a time when we were facing the lean season. At the time, food insecurity is higher because the old harvest has almost gone down, the new one unapplied yet, and people are now restricted to move out. Particularly those who feed on their feet. No? I mean, those who go out daily to fend for something, food on the table. We ask them to stay indoors, not move out, campaign. So we do a near universal cash transfer that we give cash to those households to enable them meet their basic needs while they stay at home to cope with the threat of COVID-19. And in that, we were able to meet about 78,000 households we are supported with cash transfer on 2 occasions to meet the basic needs. On how do we apportion allocation of households to communities or districts? This is taken from the social registry. Social registry, like Mr. Diba have said earlier on, is a pool of data that has every characteristic of the household, every household in this country. When we apply the PMT, we do a ranking, and the ranking will tell you these are the people who fall under the cutoff point. And based on the cutoff point is where now households are identified where they belong. So there's no need to say, nowhere where we say, in this community we give them 10, this community we give them 20, no. The list comes from the social registry that determine where households are going to be come from. As we speak now, currently we are expanding, and in one community, one very high political figure says, you give my community only 13 households, and this is a big community, so we need more and more households. But what we end up, what we explain to him is that we don't determine the number of households per community. That is determined from the data that we have in the social registry. It only so that determine what percentage, what number comes to each community based on the PMT score. I think that answers your question. My brother, Mr. Danfa, the question of expanding to the urban area. Yes, urban poor exists. There are poverty in urban areas. We are very sure of that. Even the integrated household survey shows that poverty is high in one area. But the difference is how far are you from the poverty line? The data that we use, we look at how many people are poor, but how far are they from the poverty line? So that we can help those that they are very far from poverty line, we try to bring them closer to the poverty line. That's the approach that we're using. So for the urban areas, we are expecting that by March next year, inshallah, we reach the urban areas as far as the number is concerned. How frequent is the data updated? When the project was designed, when NSPS was established, the initial focus is to have a nationwide coverage to the district. And I'm sure Iba and Kim will add more for this explanation. Once we have national coverage, now we are thinking of how do we update the data. There are mechanisms that have been put in place, keep on updating data, and I think one of them that Iba already mentioned in the morning is linking this to the CRBS. So that anytime there's a bad in the community, automatically it will fit into the social registry and it will update itself. If there's debt in the household, it will fit into the system that automatically update the household. So we are now thinking of how do we update data. I know currently the NSPA is working on updating the current data that we have by going into the communities to do another kind of exercise to look at the dynamics. But yes, poverty is not static, it's dynamic, it's changing. I can report today, tomorrow I can report, it's possible, all is possible. But we have to base it on strategies and how feasible it is to do that often. To my brother from Kenya, thank you for the compliment and also the questions. How do we manage the communities, the political dynamics? One thing that we have done as a program is we try to ensure that all those who matter, particularly those who are making decisions, are involved at the beginning of the program. We organize orientation for policy and decision makers, the governors, the tax, the National Assembly members, the chiefs, the councillors in the regions, we are all oriented about the programs, the modalities, the eligibility criteria, the implementation arrangement, and so forth. So that they are aware of how the program is designed, how it is going to be implemented across the country. So that's the first thing that we have done before we get into even the custom house. We are able to inform, educate the authorities across the regions so that they understand. Rather than them asking questions, they should be able to answer questions when those questions are asked. And some of the governors are here, they can test that. We have a meeting in all the regions to discuss about, so that we can quench the issue of queries and complaints from key political leaders in the country. How do we reduce the cost? Yes, that's the focus that we try to do. The NAFA, when it's been designed, I think we don't have systems in place. And we have to put the systems in place. And in building the system in place, we have to allocate resources for that. So it has said in the establishment of the NSPA that funds came from this. In that establishment, we also support the social registry, data collection, the MIS, all came from that. We also have capacity building that came out across the board. But like I said, when we are going into this kind of program again, the administrative cost will reduce because we are now focusing on how do we leverage on the digital power to deliver cash, deliver SBCC at minimal cost. So that's the focus of our future filial movement. How about the person with disability? Every program has its designs, it has its limitations. One limitation of this program, it doesn't specifically target disability, but they are not in that aspect. Any household that have a person, because the unit of target in this program is not an individual, it is the household. So the household criteria is what we use to determine who is eligible or not eligible. If it's an individual, you have identified categorically this target, but this house program that specifically target household rather than individual. But if there are any household that has a disabled, we give whatever is required to help the household. And I can tell you in one of our more significant story, there's one lady in Diabubu who is a disabled. Today, you go to that house, that lady, he's an entrepreneur. So in India, we have the disabled. We give them priority to make sure that they are included in the program. So I think that answers all the questions. Unless there are any other questions.
No nation is left behind in the soft region. And I believe they are linking with also the AU, and then the fundings are available. So if our government awaken to the responsibility and consider social protection as a priority, they can budget for it. Just like we are budgeting for education, we are budgeting. Even the education itself, health, the only thing is how to tell that you are doing. Because even the education intervention, health intervention, because the way we are doing it is segmented and fragmented manner. That's why we don't look at it as if we are doing social protection. Yes, but if it is well coordinated, even the ministries, what they will be doing will be minimal, because most of the work will be done by social protection. Because we have to take it multidimensional method approach. We have to do it adaptive social protection approach, data-driven, and then sectoral approach. When we have all these, we have answers. Even all the other sectors, the fragmentation will be minimal. Everybody will now say, okay, we are channeling certain percentage of our budget to social protection, because social protection is doing most of what we want to do. So then on-demand registration, yeah, we are not doing it in Nigeria, quite all right. We are not doing it. We are only doing the community-based targeting, and then we are only doing the technology, the RRR. This is where we are. What I'm telling you is, if I'm allowed to discuss and then bring in proposals for the government, it's one of the things I'm looking at, because it's all about inclusion. We want to minimize the exclusion, and we want to look at social protection beyond poverty to vulnerability, because the issue is, if you are looking at poverty, is poorest of the poor, poorest of the poor, but vulnerability is instant. It's just one thing will make you fall into poverty. All of us are on the line. No one is safe. Yes, so we have to discuss it from the vulnerability perspective. Yeah, we have the poor people, we are doing the social safety nets for them, but we have to now graduate to start looking at the vulnerability, the what-if situations. There are a lot of things. We are happy in Africa, there is no earthquake, there is no all these challenges, disaster challenges, but we can still map our own challenges to possible interventions, and then we map it to possible locations, and then be ready, waiting for it. Because if you don't know your problem, you cannot have solution. Don't wait for it to happen before you act. Then the issue of sustainability is about legislation. Legislation, creating budgets, and what have you. But if you depend mostly on donor partners, the issue of sustainability will not be there, except you create budgetary and then give legal backing by creating acts beyond policies to act. I'm happy we already have a social protection agency in Gambia. We also have social investment program agency in Nigeria. Yes, but we are also, yeah. So the government budget proportion, I've already discussed it. Institutionalization, I think institutionalization goes with sustainability. If you have the appropriate laws in place, you have the appropriate budgets in place, you will not be, you have already institutionalized the agencies. And then the coordination, I think I have said something about coordination. I'm even congratulating Gambia. This is one of the lessons I'll take home. And pray for me so that we will have the listening here. I'll use the medium you use. I can see the ECOWAS medium is working. So we'll take that. And then the lessons on the NIN, just one that I told you. You are registered now, go and check it. The names, you'll be surprised when you come to do the NIN update. You'll see people coming with their real names, telling you their real names. You will see some people having 2 accounts, 3 accounts. But because of, you go to one province, register, open with another account, but you don't have a means of, checking, verifying. You just check the surname, and before you know it, you're paying people double. But with this NIN integration, I think everybody will be carried along. I don't know, I can't exhaust all the questions, and we have kept so many people waiting. I talk too much. Thank you very much.
Thank you very much, Mr. Bala. Very, very detailed presentation. Okay, so that brings us to the final presentation for day 1. So as we are about to wrap up day 1 and prepare for day 2, is Mr. Philly Suso around? Yes, Mr. Philly, please join us on stage. So I'm sure you've heard multiple times people talking about the Gambia achieving 100% social registry. Mr. Philly Suso is the director of the Gambia Social Registry. So I think Mr. Philly Suso deserves a round of applause. And Mr. Suso will just run us through the activities for tomorrow. And then after that, we will officially close for day 1.
Okay, thank you very much, Samuel. Distinguished participants, our guests from Kenya, Nigeria, and all other countries that are present here. As we wrap up day 2 today, a very rich day, we will all agree. I think I will invite all of you to give a round of applause to our resource persons who have generously accepted to come here and share their valuable knowledge with all of us. Thank you very much. So as we close today, the aim is to build on the momentum that we have set today to take that even higher. And day 2 tomorrow, I'm very sure you have seen the program. Promises a very practical, but also solution-focused sessions that all of us should be looking forward to. We will begin the day with some powerful plenaries that bring both global and local solutions and ideas and experiences to the hearts of all of us here present. So if you look at the sessions, we will begin with a deep dive on the nexus that is there between human capital and social protection, how social protection contributes to the human capital development. And this will be led by Mrs. Aminata Bakwan Traore. This session also should give us ideas about how we should finance in the long term social protection interventions, especially how we build resilience of the poor and vulnerable in Africa. So Mrs. Bakwan Traore, a very seasoned social protection specialist from the African Development Bank, will lead this session. Then we will move into a real case study right here in the Gambia on disaster risk financing. This session will be led by a very passionate individual, and you will all attest to this tomorrow when he presents, Mr. Mauro Amadou Diallo, who will speak to how the Gambia has designed its disaster risk financing and how that is being implemented. This session, we hope, should provide inspiration to other people, especially our international guests, on solutions that we can start thinking of in our respective countries. We will also then move to a presentation on a topic that is emerging in the social protection landscape, that is social protection. We'll have this led by Dr. Art Hilger of the World Bank and Mr. Malik Pujai, the Deputy Country Director of the World Food Program. So this session is going to be a hybrid session, and Hilger will join us from New York, while Deputy Country Director Malik Pujai will be with us here in the room. So they will do the presentation together, and this should be very interesting for everyone, given the critical nature or the increasing frequency and intensity of shocks, whether these are natural, whether these are climate-induced or economic crisis that we all face. I don't want to say what active social protection is so that it doesn't preempt the presentation tomorrow, but this is something that is critical as countries face increasing shocks. And then we will move to look at there were a lot of questions today after the presentation on NAFA cash transfer. How updated is the data? How are we sure that we are targeting the right people? So there will be a presentation by ID Insight, by the head of ID Insight from Dakar. Mr. Tobin will lead this presentation, and it's specifically going to tell us how data can define targeting to PMT. Most often, PMT is criticized for not being accurate, but this approach has been piloted in Kenya by ID Insight, and Mr. Tobin from ID Insight is going to share that experience with us. And lastly, on the plenaries, we will look at the how mobile money has revolutionized service delivery, especially cash transfer in Kenya. Kenya stands tall among countries in terms of their experience in mobile money payments to over 4 million individuals. You can imagine how they do that. And Mr. Peter Ombasa will help us deliver the presentation. And it should give us real actionable insights on how we can adapt and apply digital payments in our country. It brings a lot of cost advantages in terms of the administrative costs associated with digital payments. I think the highlight of the day will come in the afternoon when we will have breakout sessions. And so we will have parallel breakout sessions, and the first one will tackle health insurance towards universal health coverage, how health insurance is going to help us to increase coverage and ensure that we will leave no one behind. And this, as the other breakout session, will take the following format. We'll have a presentation, and then we'll have the presenter and some other people sit in a panel to take questions, both from the moderator and the audience. The paper presentation will be led by Mr. Jibril Baji from the Director of Planning at the Ministry of Health, and then he will be joined in the panel by representatives of the Ministry of Gender, the Gambia Federation of the Disabled, and a few others. And in session B, we'll look at gender, children, and disability inclusive social protection with powerful voices of UNICEF. You can imagine how passionate UNICEF is talking about children's issues, how UNFPA is passionate about talking about gender issues. So we will listen to a presentation by UNFPA, and then they will be joined in a panel by UNICEF, the Ministry of Gender, and a representative of the Gambia Federation of the Disabled. So these sessions are about real solutions that we are looking for to expand coverage and reach the most vulnerable in our different countries. So we hope that we will all take it seriously and go. So as we go home today, take rest, reflect on whatever we have said here, and come back with a new energy, you bring your ideas, and we see how they unfold tomorrow. We want to thank you today for your contributions. It's been a fantastic day, and we just hope that we'll all come back tomorrow refreshed to continue the momentum that we have set today. Thank you very much.
Thank you too.
so dañ di ñëw di la laaj seen ndaje bi nga xam ne yéen ko amoon fii tey déet bi sax waaye garaaw ndaje li nga xam amoon na fi tey ci soo ba léegi yéen ci woon doon def ay discours yu yaatu waxtaan yu yaatu mu nekk xam-xam boo xam ne xam-xam bu ne wàcc na fi ñi bëggoon xam laaj la tey waa Njolenti bi di la doon laaj lan moo waral ndaje bi tey.
Waaleykum salaam man la Faye ndaje bi tey comme ni nga ko laajtee lu ko waral mooy ñaari at bu nekk dëkk bi dañ dee def façon ndaje yi pour ñu waxtaan jéem a seet ndimbal buy ñëw si néew doole yi naka lañ ko dee dépassé ak tamit su dee soxla nañ yokkute si wàllum dépasse bi naka lañ ko war a tëralee soo seetloo am na dëkk yu ñëw tey daanaka si biir waxtaan bi ñoom tam yaatal nañ seen dëkk yi ni ñoo def yan tànka lañ teg pour tamit ñu jéem a mun a wàññi ab ñàkk parce que ñun ñëpp xam nañ ne si wàllum Afrika ñàkka sonal nañu lool te lu si ëppa doole néew doole yi la gën a mun a sonal loolu moo tax waa dëkk yooyu tam day ñëw ñoom tamit su ko defee ñuy mayante xalaat ñu ñoo wax ñoom naka lañ dee mun a jàppale seen néew doole yi ñu ni tamit ñu jàngee si ñoom su ko defee ñu seet si ay at si kanam beneen ñaari at si kanam dëkk bi yan bunte la mun a fugga ak tamit yan xeetu ndimbal lañ mun a indi si dëkk bi pour surtout néew doole yooyu noonu pour seet nuñ mun a wàññee ak ñàkk si biir dëkk bi.
ok léegi lii nii nga xam ne yàgg ngeen ko def wala ren mooy nekk premier at bi ngeen ko def wala nekk na lu yàgg daal wala yàggu.
déedéet yàggu ren mooy deuxième at buñ ko def.
ñaareelu at bi.
waaw ñaari at si gannaaw moom lañ defoon bu njëkk ba. kon si gàttal bi mooy ñaareelu.
bi mooy ñaareelu tour ba second round bi.
waaw bi mooy second round bi yaa ngi gis ñaari at si kanam. 2027.
ay non
dinañ amaat beneen incha allah.
jàpp ngeen ne liggéey bi ngeen di liggéey mu ngi dem ci kanam wala jàpp ngeen ne.
waaw jàpp nañ ne liggéey bu ñoo def nii mu ngi jëm si kanam parce que soo ko seetloo si biir waxtaan bi wax nañ si nguur gi fu mu nekk nii ndimbal bu mu nekk di dimbale néew doole yi du ñëpp nag ba pare néew doole soo dem dañ gën a néewante doole yaa ngi gis moo tax soo dégloo ñu ngi wax nu ñu ooyee social register daanaka loolu dafa nekk ne comme nguur gaa dugg si biir dëkk yi seet ñi gën a néew doole ak seen néew doole fu mu toolu ak seen soxla fu mu tool ñu tegee leen boor ba nga xam ne su ndimbali néew doole waree ñëw jarul sax ñuy dugga di seetaat kan ak kan moo néew doole dafa fekk ne suñ demee si ñi nga xam ne ñoo yoree wàllum wàññi ab ñàkka ñooñu am nañ nit yu nga xam ne ñoo néew doole si dëkk bi ba pare nit yu nga xam ne ñoo ñàkk si dëkk bi ba pare dañoo dem si ñooñu rek ñu taana ne ñu néew doole mbite ñu ñàkk a boor bii lañ soxla su ko defee ñooñu dinañ xool rek ñu wax la demal si diw ñooñu dañ ñàkk.
ok léegi ñàkk boobu ñooñu noonu xam nga nit ku ñàkk comme man tey jii soo ma joxee benn xaalis mën naa dem ci marché jënd lu neex rek lekk ko mu jeex wala da ngeen am projet bu ngeen teg pour jënd ko matériel jox leen ko ñu mën ci liggéey loo xam day jur ëllëg lu yokk seen koom-koom.
ok léegi pour jàppale ku ñàkka li nga wax am na solo torop soo ko joxee xaalis lu moo xalaat mooy dund waaye soo ko seetloo si dëkk bi pour wàññi ab ñàkka ak dimbal néew doole dafa am bunta yu bari ñu bëree cee yëngu waaye yëngu yooyu noonu yëpp moom la ñoo boole di ko waxtaanee fii lu jiitu si waxtaan boobu mooy pour di jox ñi ñàkk yi weer bu nekk am nañ ñu ko def fu mu nekk nii nguur bi am na bu boor buy def loolu yaa ngay gis dañ leen di jox ñetti junni si suba si am na vidéo buñ teg kenn si ku doon am boobu noonu mu ngi wax ne ñetti junne boobu daf si teg juróomi téeméer mu jënd ak fukki ginaar ak juróom mu yokk si lim am kon xam nga kooku commencé na business mu ne dëgg la wàññiwut ñàkkaam tout mais wàññi na ko naka la tuddaati 90% waaw yaa ngi gis xam nga loolu am na yokkute bu mu def waaw am na ñeneen ñoo xam ne tamit nag am na yeneen projet comme soo duggee si ñi organiser lii tey ñoom ñoo amee buntu nguur bi nga xam ne ñoom lañ sas pour indi ay firnde yuy wàññi ab ñàkk si dëkk bi ñoom am nañ projet buy daw boo xam ne soo seetloo si wàllum base yee boor yooyu ngunu
sama dëkk
waaw xalaat ne dem nañ ba seetaat gis ne ab ñàkk bi foofu la gën a métti
bu baax sax
yaa ngee gis am na projet yu ñoo dawalee si jamono yi foofu ñu ngi def li nga wax ni mooy jàngal surtout jigéen yi ak ndaw yi nga xam ne dañ jàng ba si diggan yu bàyyi mbi te mosu ñoo jànga pour jàngal leen métier su ko defee ñi nga xam ne ñoo gën a xarañ ci métier bi ñu seet nuñ leen tànnee dugal leen si business muy ab béy bi la muy ab yar rab yaa ngee gis mu am xëj na soo amee sa jiw ba pare nga defaraat ko mooy ñiy defar cuuraay yeeg dukkulaay yeeg loolu yëpp xam nga si koom-koom la waaw loolu yëpp pour si gàttal maa ngi laa wax dimbal mun naa ñëwee si façon boor bu nekk soo buggee aw wàññi ñàkk nekkul nga jox nit ki xaalis rek xam nga am na ñi nga xam ne mag yi si dëkk yi ñoo gën a sonn parce que ñooñu daanaka amuñ xaalis te ñaareel suñ feebaree sax problème la pour faju waaw beneen boor boo mun a wàññee ab ñàkk mooy nga jàppale ñooñu ci fayal leen wàllum faju du dégg waaw moo tax ma ne la soo seetloo si wàllum wàññi ñàkk si biir dëkka am na bunta yu bari yoo xam ne moom nga mun a gestu su ko defee ndimbal bi yëpp soo ko boolee mu mun a am solo mu mun a am maana su ko defee wàññi pour wàññi ñàkk bu nga bëgg si dëkk bi dina mun a am waaw.
kon waa Njoreen TV la foofu sax la jóge CRR.
This brings us to the end of the program. Thank you for joining us here at the start of our conference call. Today is the first day because it is a 3 day program. Till tomorrow we'll come back again around 3. Keep following Jungle Online TV. Do subscribe on our social media handles. We are on YouTube, Facebook, Instagram, and Twitter. Thank you. Bye.